In late February of 2020, the country was business as usual. An international biotechnology conference underway at the Marriott Long Wharf Hotel was no cause for concern in a world largely unaware of the pandemic to come.
We didn't know super spreading events could happen with COVID.
Dr. Paul Biddinger is chief of the Division of Emergency Preparedness at Mass General Hospital. He's also chair of Governor Baker's COVID-19 Vaccine Advisory Group. He says at the time of the conference, MGH had only seen a handful of COVID-19 patients.
We got the call that there were a few individuals who'd been at this conference, who'd been around someone with COVID. It was really in the next 2 days after that when multiple individuals began to have symptoms that it became pretty clear that probably there was transmission at this conference. And that meant that although we'd had 2 cases in Massachusetts before the conference, that the number was likely to increase substantially.
And it did. In an analysis published in the journal Science last year, the coronavirus strains at that conference would infect as many as 300,000 Americans, spread to 29 states, and be detected in countries around the globe. Biddinger says that's because there were 2 key things we didn't know then.
We didn't actually know about the possibility of pre-symptomatic or asymptomatic transmission. We also didn't know how much testing capability we would need.
And he says that's a lesson we need to pay attention to. He says investment in public health, in testing and contact tracing must be a priority as we look to the future.
We need to continue to invest in our preparedness for biothreats. The threats themselves, again, are not going to go away, and we need a really, really robust response at the first signal that something is changing.
He thinks by fall we could feel some sense of normalcy if vaccination rates are high to keep virus rates low and protect those who are most vulnerable.
If the medical consequences of illness go away or substantially less, meaning very few people are at significant risk of dying or being admitted to the intensive care unit, then I do think we can actually start getting back closer to normal.
So there's still some question about the role the virus variants will play in transmission, but Dr. Biddinger says there's encouraging data about the effectiveness of vaccines against some of them out of Israel, Johnson & Johnson today. In the meantime, people should stick with the basic precautions that we know work.